Good morning, bonjour à toutes et à tous. Moi, je m'appelle Anne Lagacé Dowson, je suis directrice des communications pour la Coalition canadienne de la santé, qui a été fondée en 1999 par, entre autres, Tommy Douglas, avec l'idée de protéger et faire avancer l'assurance santé au Canada. Et quelques années plus tard, en 1984, le travail de la coalition a donné la loi canadienne de la santé, entre autres, avec Monique Bégin. Alors, we're here this morning, roughly at the halfway point of the federal election now underway, to focus on the central role, the critical role of healthcare for the future of this country. And we feel that it hasn't been addressed sufficiently in the campaign. And we also feel that healthcare is the main thing that differentiates Canada from the US, not just hockey and maple syrup and monumental geography and the minerals of the Canadian Shield, but little cards like this that we all have, which guarantee that we will get the health care that we need. Now, the system is not perfect, and some would say terribly flawed. Nonetheless, this is what a lot of Americans envy that we have here in Canada and that we need to protect. So far, what we have from the two main leaders of the old line parties is that Carney has said, and he said in his inaugural speech, that in the U.S., healthcare is big business. In Canada, it is a right. But we didn't hear anything further from him on that. And last night on Tout le monde en parle, which is the huge program that everybody watches on Sunday nights in in Montreal, right across Quebec, about 1 million viewers watch that program. Pierre Poilievre said that, and much to my surprise, he said that public education and healthcare are the things that allow Canadians to move up in the world. So despite his voting record, he's now on side with public programs, apparently. Anyway, in Canada, we take care of each other. We have a safety net, a functioning one, with healthcare at its center, and it's invaluable, and that's one of the reasons we're here today. So we need leaders and journalists to talk about healthcare at the leaders' debates on Wednesday and Thursday, and in general in the last half of the campaign. And we have three wonderful interlocutors on this topic today. We have Dr. Amanda Black, who is the former president of the Obstetricians and Gynaecologists Association of Canada. And we have Frédérique Chabot, Executive Director of Action Canada, a merger of Planned Parenthood and other organizations working to advance and uphold sexual rights and health. And in closing, Steve Staples, the Director of Policy at the Canadian Health Coalition, will speak. Thank you.
Good morning. My name is Dr. Amanda Black, and I'm here as the past president of the Society of Obstetricians and Gynaecologists of Canada and as a practicing obstetrician and gynecologist. I'm also here as a woman, as a mother, as a sister of someone with type 1 diabetes, and as a Canadian. Merci d'être avec nous aujourd'hui pour une conversation qui devrait être au cœur de chaque débat électoral à travers le pays. Let's be honest, Canadians are going through a challenging time. They're worried about jobs, they're worried about the economy, and they're worried in the face of all economic uncertainty about what happens if they lose their benefits or can't afford their medications. And yet, despite all this, healthcare has barely come up in this campaign. And that's why we are here today. Nous sommes des professionnels de la santé, des défenseurs des droits et des leaders communautaires, représentent nos membres de tout le Canada, et nous sommes ici pour dire une chose haut et fort. Les soins de santé ne peuvent pas être une préoccupation secondaire dans cette élection. Et lorsque nous parlons des soins de santé, nous devons parler des femmes, car la santé des femmes au Canada est laissée pour compte. Healthcare cannot be an afterthought in this election. And when we talk about healthcare, we have to talk about women, because women's health in Canada is being left behind. Despite our international reputation as a leader in sexual and reproductive rights, the reality at home tells a different story. Canada now ranks 10th out of 11 high-income countries on the Hologic Global Women's Health Index, behind the UK, behind Australia, behind the United States. We can and must do better. So today, we are calling on all federal parties to commit to action. First and foremost, the SOGC urges all parties to commit to a truly national pharmacare program that includes universal access to free contraception for all women in Canada. La SOGC exhorte tous les partis à s'engager en faveur d'un véritable programme national d'assurance médicaments qui inclurait l'accès universel à la contraception gratuite pour toutes les femmes au Canada. Just think, women spend approximately 35 years of their lives in their childbearing years. A woman planning to have 2 children will spend 5 years on average trying to conceive, being pregnant, and then breastfeeding. That means that Canadian women spend on average 30 years of their lives shouldering the associated costs of trying to avoid a pregnancy. Many people think that contraception is already covered for everyone. What many do not realize is that Canada has had a patchwork approach to coverage, often depending on income, your job, where you live, or even your partner. Many don't realize that too many women are slipping through the cracks, that there are simply too many obstacles for them to overcome to obtain contraception. So they give up, and sometimes this results in an unplanned pregnancy. And I see this every week in my practice. Right now, 40% of pregnancies in Canada are unintended. The lack of coverage and the associated risks of unintended pregnancy is unacceptable in 2025, especially during a time of economic upheaval when more people are at risk of losing their jobs and their health benefits. Bill C-64, the National Pharmacare Act, which provided universal coverage for contraceptives and diabetes medication, received royal assent in October 2024. But up until today, only 3 provinces and 1 territory have signed a bilateral agreement with the federal government. La liberté de procréation ne signifie rien sans excès. We can do better for Canadian women. We talk about the cost of universal contraception policies. We also need to look at the cost of inaction and the economic impact directly felt by women and their families. The direct cost of unintended pregnancy in Canada is estimated to be at least $320 million and does not factor in the downstream cost to the individual, their community, or society. When British Columbia brought forward a policy on free access to contraception ahead of all other provinces and territories, cost modeling showed a cost savings of $20 million per year by year 4. That means for every dollar invested in contraception, there's a cost savings of $5 per BC resident. And when we look at the societal impact, we can't forget that this policy will ensure that women are empowered with the tools to better control their futures, including family planning, educational pursuits, and workforce entry and re-entry. It will help women to stay in school, provide opportunities for other children in the family, and improve food security. Universal access to contraception is just one part of the picture, but it is an important first step. The SOGC is calling on for 3 key investments in women's health that are practical, achievable, and good for the economy. These include expanding care and investing in women's health, improving how we collect and use data on women's health, and committing to protecting and expanding sexual and reproductive rights in Canada. Sexual and reproductive health and rights are basic human rights, but they are under threat. Access across Canada is unequal, and misinformation about reproductive health is spreading, especially in social media platforms. We're asking parties to take a stand. Commit to protecting these rights, expand access to sexual and reproductive care, and work with provinces to make this universal. Nous demandons à tous les partis de s'engager à protéger et à étendre la santé et les droits sexuels et reproductifs au Canada. L'accès reste inégal à travers le Canada. Les droits fondamentaux des femmes doivent être respectés et les soins doivent être étendus. Let me be clear, this isn't just a call for better health outcomes. Il s'agit d'un appel à une économie plus forte, car lorsque la santé des femmes est menacée, notre économie l'est aussi. And the moral case is even more clear. Access to contraception transcends reproductive rights and is the cornerstone of public health and equity. No individual should be prevented from accessing contraception due to income or where they live. Universal contraception coverage will produce immediate benefits for our society and have an intergenerational impact. This policy will ensure that women are empowered with tools to better control their futures and reproductive life plans. Aujourd'hui, nous ajoutons donc notre voix aux nombreuses Canadiennes qui nous ont dit, en tant que médecins dans nos cabinets, dans les établissements de soins cliniques, encore et encore ce qui leur tient à cœur. Les soins de santé sont importants. La santé des femmes est importante. Et les Canadiennes méritent mieux. We're calling on all political parties and all candidates to step up in this campaign. Make real, concrete commitments to health. Let's be a beacon of light to the world that in Canada, we take healthcare seriously and women's healthcare seriously. Because better care doesn't just save lives, it builds a stronger, fairer, more resilient Canada. Thank you.
I don't know that I have anything to add after Dr. Black's address, but thank you and good morning to everyone. Bon matin tout le monde. Imagine a parent sitting at the kitchen table with a partner or alone, looking over their monthly budget. Rent is due, groceries have gone up. The kids need new shoes. They open the medicine cabinet and realize the birth control prescription needs to be filled, but so does the prescription for their child's asthma inhaler. There isn't enough for both. These are not theoretical scenarios. These are the decisions too many families in Canada are forced to make, decisions that go to the heart of family planning, health, and dignity. We are just getting started on a pharmacare program that could soon ensure no family would have to make the impossible choices between food on the table or the medication they need. Right now, free contraception for all is within reach as one of the two first classes of medication pharmacare can deliver to Canadians. This is no small thing because reproductive health care is health care, and contraception access is not a luxury, it's a lifeline. It profoundly shapes people's destinies, their families, and entire communities. We are witnessing a moment unlike any other. Around the world, power is shifting. Economies are being reshaped. Long-held norms are being questioned. And here at home, as these changes unfold, our federal election stands apart. This is not just about who will lead us for the next 4 years. It's about who we are as a country and who we want to be. The choices our leaders make today will shape the Canada of tomorrow, and these choices will echo for a very long time. Social programs are the backbone of a strong economy, and we need to know where our leaders stand on them. We need to see healthcare and pharmacare be a big part of the conversation, and we have not seen that so far. As Canada faces destabilizing threats, tariffs from our neighbors to the south, global economic shifts, and soaring costs here at home, we need to see doubling down on investments that build social programs that are not just safety nets, but springboards to communities that thrive. This is the Canada that is worth fighting for. Right now, more and more people are struggling to afford contraception, treatment for endometriosis so the pain doesn't mean having to take so many sick days that people risk losing their job, menopausal hormone therapy so they can sleep at night, and the everyday medications that keep them healthy and prevent bigger health crises down the road. As pharmaceutical tariffs loom and job losses erode extended health benefits, if those benefits even existed in the first place, the situation is getting worse. Let me be clear. Pharmacare is not just a health policy. It's an economic policy, a gender equity policy, and a human right imperative. Programs like Universal Pharmacare build a society that can weather crises, not just because they offer real solution to the affordability crisis that we face every day, and also deliver incredible economic returns on every dollar invested, but because they represent a fundamentally different vision for our future. These are economic policies rooted in care and collective resilience, standing in stark contrast to the policies of fear, division, and privatization that brought us Trump to the South. These policies aren't nice to have. They are essential to building a Canada where everyone thrives and where we lead not by leaving people behind, but by lifting everyone up. And yet, we're still debating whether gender equality, reproductive health, or access to contraception should be part of the plan. Gender equality and access to essential medicine must never be an afterthought, because let's talk about what a full contraception coverage actually does. It allows people, especially women, or anyone who can get pregnant, to decide if, when, and with whom to have children. It allows them to continue their studies, pursue careers, and plan their lives as they want it. This is the power of choice, and it's fundamental to building communities where families thrive, poverty is reduced, and violence is prevented. And to those who say, let's just plug the gaps, we say this: the gaps are not narrow, they are wide, and they disproportionately impact women, low-income workers, and people in precarious jobs who move in and out of coverage. They particularly screw over young people, people in situations of domestic violence, or people with heavy medical needs. A patchwork solution won't cut it. We need a universal public pharmacare program that covers the full range of essential medicine, including contraception and all medicine that are essential for optimal sexual and reproductive health for everyone. Change comes from demanding better, not settling for less in time of crises. In this election, Action Canada for Sexual Health and Rights, alongside all the Planned Parenthood network of sexual health clinics that are on the front lines every day, and our colleagues, healthcare providers and advocates across the country, we are calling on all political leaders to put forward a clear and uncompromising commitment to universal pharmacare and to robust public healthcare systems across the country. This is the moment to decide what kind of country we want to be. A Canada where no one is left behind. A Canada where we can go to the doctor when we need it or when our child needs it. A Canada where everyone has the power to decide their own future. Thank you. Merci.
Thank you, Fred. Thanks, Dr. Black. Thanks, Anne. My name is Stephen Staples. I'm National Director of Policy and Advocacy for the Canadian Health Coalition. I'll be brief. I'll just let you know we're going to be showing a brief video in a few seconds. It's clear that healthcare remains one of the top issues on Canadians' minds at all times, and particularly going in to this election. But we have to be more clear about where the party leaders stand on healthcare, and we've not had that clarity. Some parties have put out very detailed plans. Other parties have only responded when journalists ask a question, and some parties hardly even take questions from journalists. That's why the debates coming up this week offer a clear opportunity for Canadians to hear from the leaders on what their plans are for healthcare. So if I was a member of the consortium compiling questions for the debate, I would have a few suggestions to put forward. So that's why the Canadian Health Coalition has launched a campaign called Vote Healthcare for Election 2025. And we are going to be putting up a video, an online ad that we're going to be running across the country in French, the same campaign. The questions that we're asking candidates are this. First, on Medicare, will you and your party ensure public health care is provided to everyone in Canada based on their medical need and not their ability to pay, by championing our cherished single-payer universal Medicare program? Question 2, on pharmacare. Will you and your party work with provinces and territories to provide free contraceptives, diabetes treatments, and other types of prescription medication to everyone in Canada through the new National Universal Pharmacare program? And 3, some time on dental care. Will you and your party make the Canadian dental care plan conform with universal Medicare by extending free dental coverage to everyone in Canada, regardless of their age, household income, or private insurance coverage? So those are the 3 core questions that we have for our Vote Healthcare Election 2025 campaign. And today we are launching this online ad on platforms across Canada.
Is under threat, and so is our health care. Donald Trump says he will make Canada the 51st state, and we will benefit from better health coverage. But in the USA, big pharma is big business. Medical debt is the leading cause of bankruptcies, and thousands die every year because they don't have private coverage. Who wants that? In Canada, we use our tax dollars to provide free hospitals and doctors to everyone. On April 28th, we can elect people who will defend public health care and make it even better with free medicine and dental care. This election, let's vote for Canada. Let's vote for health care.
Did you guys get that okay? Did you want to roll that back, or was it all right? It's okay. I think the first of it got clipped a little bit, but that's okay. We'll put it online. Okay, merci beaucoup.
Merci.
Thank you.
S'il n'y a pas de questions, il n'y a pas de journalistes dans la salle. On vous remercie beaucoup, les gens de la tribune de presse, entre autres. Alors, merci beaucoup à Sarah et à Jordan.
Merci. C'est ce qui conclut cette conférence de presse. Thank you. This concludes the press conference.
Merci.